Chapter 32, Vaccines and Immunomodulators. We'll skip over the key terms because we will cover them in the lecture. An immunization is defined as a deliberate artificial exposure to disease to produce acquired immunity. A vaccine is an altered antigen injected into your body that does not cause disease, but stimulates your immune system's production of antibodies and cytotoxic T cells, providing protection against the disease if you're exposed to it again. Live attenuated vaccines are a living but weakened version of the invader virus and do not cause disease in healthy individuals. However, they can mutate to a virulent strain of the virus. Measles, mumps, and rubella, chickenpox, shingles, influenza nasal spray, and rotavirus vaccines are all live attenuated vaccines. Inactivated killed vaccines are advantageous because they cannot mutate, but they produce less immunity compared with live vaccines. Booster shots are usually required to ensure continued immunity. Flu, hepatitis A, polio, and rabies vaccines are inactivated killed vaccines. Toxoid vaccines stimulate the immune system to produce antibodies to the toxins that cause illness. Subunit vaccines contain an isolated part of the bacteria or its coating. They may be genetically engineered by inserting a virus protein or gene coding into another virus when it replicates to produce the vaccine. Hepatitis B and HPV vaccines are subunit vaccines. Conjugate vaccines link pieces of the bacteria or virus coating to a carrier protein or carbohydrate that allows the immune system to recognize and attack these disguised pathogens. The Hib vaccine is a conjugate vaccine. Vaccines and immunologicals requiring refrigeration must be protected from extremes in temperature. Exposure to freezing temperatures or heat can destroy their integrity and make them unstable and unusable. The cold chain refers to a set of safe handling practices that ensures vaccines and immunologicals requiring refrigeration are maintained at the required temperature from the time of manufacture until the time of administration to the patients. This means that they must be maintained at a constant temperature from 2 degrees Celsius to 8 degrees Celsius throughout the transport process and placed in appropriate storage units once they are delivered to their final destination. When the cold chain is disrupted, it is considered a public health threat. The effectiveness and shelf life of vaccines are reduced, and the stability of the vaccine decreases exponentially with each increase in temperature. Disruption of the cold chain is also costly. Vaccines that expire or that have been stored improperly must be destroyed. Once a vaccine is received, the pharmacy should place it in a refrigerator designated solely for vaccines. An important component of the cold chain is establishment and adherence to protocols for receiving, stocking, storing, and transporting drugs requiring refrigeration. The pharmacy team should develop these protocols in accordance with national guidelines.
Was compassion, caring, and loving. That's really how I would like to get remembered.
Pharmacy personnel in charge of transporting vaccines are responsible for making sure that the vaccines arrive at their destination at the proper temperature. Vaccines are administered to provide immunity to a wide variety of childhood diseases, as well as influenza, hepatitis, pneumonia, viral meningitis, rabies, and other conditions. Epidemiologists track flu infections from centennial sites around the globe to determine which strains of the flu virus are most virulent. Vaccines are developed for the most infectious strains of the virus. Flu vaccines must be reformulated every year. Figure 32.3 shows age-specific immunization schedules as recommended by the CDC. This table shows selected vaccines, dosage forms, and strengths. We also have the storage information on the side as well. So there is a lot of vaccines out there. A lot of them which are a little harder to say than most drug names. We'll go through some of them though. So there's a tetanus immune globulin vaccine, diphtheria toxoid, tetanus toxoid, pertussis, and hepatitis all in one vaccine with inactivated polio. So there has been a lot of advances in vaccines, probably since most of us have been children, especially me. You can see all of these. The vaccination in the pharmacy, especially since the pandemic, has increased for sure. Flu vaccines, pneumonia, and shingles have always been something that the pharmacy did pretty frequently, but I think a lot more are being done in the pharmacy atmosphere now. Drugs that primarily act on cells of the immune system are called immunomodulators. An immunomodulator is an agent that modifies the immune response or the functioning of the immune system. Immunomodulators that suppress or reduce the strength of the body's immune system and inhibit the rapid increase and spread, proliferation of cells of the immune system are called immunosuppressants. Their actions may be cell-specific or non-specific. Cyclosporine, pimecrolimus, and tacrolimus are classified as calcineurin inhibitors. Cyclosporine is produced by a fungus and is used to improve survival rates with individuals that have received organ transplants. Tacrolimus and pimecrolimus are immunosuppressants. Tacrolimus is derived from a fungus and it is used to prevent transplant rejections. Tacrolimus ointment and pimecrolimus cream are used for treatment in mild to moderate chronic atopic dermatitis. T cells are important to immune response. Cyclosporine reduces cellular responsiveness to inflammatory stimuli by inhibiting T lymphocyte cell activation and suppressing interferon gamma. Cyclosporine is formulated as capsules, modified in non-modified oral solutions, and solution for injection. The modified solution has greater absorption than capsules, and cyclosporine inhibits cytochrome P450 microsomal pathways, which are responsible for several drug-drug interactions. Tacrolimus and pimecrolimus inhibit the first phase of T cell activation and proliferation. Adverse reactions of cyclosporine can be acne, bleeding or tender gums, overgrowth of gum tissue, diarrhea, headache, leg cramps, anorexia. Because cyclosporine is an immunosuppressant, it can increase risk for infections. Tacrolimus may increase the risk for bacterial, fungal, protozoal, and viral infections, thrush urinary tract infection, and upper respiratory infections. It may also produce GI adverse reactions such as diarrhea, constipation, loss of appetite, nausea, and vomiting. Other common side effects are headache and visual disturbances. And the most common side effects of tacrolimus ointment and pimecrolimus cream are burning, itching, and skin infections. So again, here is the calcineurin inhibitors and all of their different dosage strengths and names of everything. For the cyclosporine, there's Nerol, Sandamune, Gengraph, And then also the eye drops for stasis for dry eye are also cyclosporine. Everolimus and sirolimus are mTOR kinase inhibitors that are used to prevent organ rejection in kidney transplant patients. Sirolimus is the active metabolite of the immunosuppressant temsirolimus. Everolimus and sirolimus may increase the risk for infections, just as the above ones do as well. Side effects can be ulcer, insomnia, dizziness, drowsiness, hair loss, headache, mood changes, depression. And the most serious adverse reactions can be seizures, hepatitis, and hemolytic anemias. Sirolimus tablets and oral solutions are not bioequivalent, so they should not be substituted for each other. mTOR kinase inhibitors, which we've already talked about. Here are the different dosage forms and strengths. Azathioprine, mycophenolate, and mycophenolic acid are antimetabolites that are used in conjunction with corticosteroids and cycloben. Yeah. Azathioprine, mycophenolate, and mycophenolic acid are antimetabolites that are used in conjunction with corticosteroids and cyclosporine to decrease the rejection of transplanted organs. Mycophenolate is a prodrug that is metabolized to mycophenolic acid, which is immunosuppressive agent that inhibits the enzyme required for the synthesis of purines. So here we have the antimetabolites listed in their different dosage forms. Monoclonal antibody immunomodulators are used in the treatment of numerous autoimmune and immune system disorders, such as multiple sclerosis, rheumatoid arthritis, and Crohn's disease. A common ending for monoclonal antibody immunomodulators is MAB. Monoclonal antibodies act on B cells, T cells, and surface proteins important to the immune system, specifically leukocyte surface antigens, including CD3, CD4, and T cell activation markers. Monoclonal antibodies may increase susceptibility to opportunistic infections, reactivation of dormant infections like tuberculosis, or worsening of an existing infection. So we have a list of monoclonal antibody immunomodulators. These are newer medications, and not new in the sense of like the last 5 years, but new, I'd say, in like the last 20 to 25 years. Being really popular and used for many different autoimmune diseases. Humira, you might have seen commercials. It works for so many different things. It is a great drug. So that has that common ending of MAB, same as Simulect, Cimzia, Zinbrida, Simponi, Infliximab, Natalizumab, Rituximab, and tocilizumab. There are approximately 2,000 interferon receptors on each normal and malignant cell. These receptors recognize and bind interferon proteins with antigenic properties. Interferon alpha 2b or beta is used to treat hepatitis B and C. It's also used to treat cancers like multiple myeloma and chronic myelogenous leukemia. Interferon B1a or beta 1 alpha and beta 1b are first line therapies for the treatment of MS. They alter the actions of T cells, B cells, and other cytokines that produce immune system response and inflammation. So again, here we have the interferons and all their dosage forms and strengths. All of these are injectable medications. Anti-thymocyte globulin, human immune globulin, and RHOD immune globulin are immunoglobulins. ATG is primarily administered to reduce the rejection associated with organ and bone marrow transplantation. RHOD immune globulin is administered to pregnant women who are Rh negative and have been exposed to blood that is Rh positive. So meaning if they're Rh negative and their fetus is Rh positive. This may occur through exposure to fetal blood, amniocentesis, ectopic pregnancies, excuse me, abdominal trauma during pregnancy, or whole blood transfusion. When an Rh incompatibility exists between the pregnant woman and the fetus, maternal antibodies are produced that act against the fetal red blood cells, causing erythroblatosis fetalis, a severe hemolytic disease of the fetus. Anti-D administered within 72 hours of delivery can prevent this from happening in a subsequent pregnancy. RHOD is also used in the treatment of idiopathic thrombocytopenic purpura, a condition that causes excessive bruising or bleeding. And IVIG is used for the treatment of a variety of infections and chronic lymphatic leukemia. ATG is prepared by immunizing horses or rabbits with human thymocytes. The resulting horse immunoglobulin or rabbit immunoglobulin that fights against human T cells is then collected and purified. So this chart lists the immunoglobulins that we have on the market. And you can see over here, we have the dosage forms and strengths. And then here are the US brand names on top. Belatacept is a selective T cell co-stimulation blocker that is used to prevent post-transplantation rejection in adults receiving a kidney transplant. Persons taking this medication should not receive immunizations with live viruses. The medication Gilenya is an immunosuppressant that is used to treat MS. And it is believed to reduce lymphocyte migration into the central nervous system. Glatiramer is an immunostimulant that is used for the treatment of multiple sclerosis. And the most common side effects from that medication are local site reactions, itching, dyspnea, vasodilation, or hypersensitivity reactions. So belatacept comes in a powder for injection. Gilenya comes in a capsule, so you will see that in retail pharmacy. And you'll also see Copaxone, Glatiramer in the retail pharmacy or specialty pharmacy world. We have the summary of selected immunomodulators. So we have the generic name, brand name, the use in this chart. So for Neurol, we have heart and kidney transplantation, prophylaxis. So prophylaxis means stopping something before it happens. So we want to stop any rejection of those new organs. You should avoid pregnancy, avoid grapefruit juice. That's a big one. Grapefruit juice interacts with tons of medications. Do not refrigerate, and discard discolored or cloudy solution for injection. For Prograf, also we have take on an empty stomach and avoid grapefruit juice. Same with everolimus, avoid grapefruit juice. That one you should also avoid prolonged exposure to sunlight
and use sunscreen. So meaning if you were to go out in the sun without sunscreen, the side effect is probably going to burn you a lot worse than you normally would. And then for the immunoglobulins, gently rotate solution, do not shake. We should protect from light and not freeze. Excuse me. Scientists are researching innovative ways to deliver vaccines. Current delivery systems include nasal sprays like the flu vaccine. Future delivery forms may include food. Scientists are conducting research on edible vaccines made from genetically engineered foods such as potatoes and bananas. They have engineered a potato-based vaccine against hepatitis and are also modifying bananas to prevent noroviruses. Other food-based vaccines are also being researched. Keep in mind, this book was written way before COVID was ever a thing. So if you think about the future of vaccines and what they're capable of, and we just seen them used in action very recently.